Hello, and welcome to another episode of Ask a Black Doctor. I am your host, Miracle Jones. Don't worry, you are not seeing things wrong. I am filling in for Jasiri X this evening as he moderates a town hall in Wilkinsburg about the future for Wilkinsburg. So I'm sitting in. We have a great show for you all tonight. Ask a Black Doctor is a show that we do in partnership with Gateway Medical Society. Gateway Medical Society is an amazing organization of Black and Brown doctors and medical professionals that was founded in 1963 right here in Pittsburgh with the mission to eradicate disparities in healthcare, specifically within Black and Brown communities. And we're very, very honored and excited to have two great doctors come on. They're going to join us now. Dr. Edwards and Dr. Simmons are going to be here, for the hour. And they're going to talk a little bit about themselves so we know who they are, what their specialties are. And then we're going to talk tonight about diabetes, the flu and COVID, and what that means for you and your loved one's health. So thank you so much for joining us, Dr. Edwards and Dr. Simmons. If you could just introduce yourself and tell us a little bit about the work that you do.
Good afternoon. Well, I'm Dr. Anita Edwards. I'm with Gateway Medical Society. I'm presently the treasurer for Gateway's Medical Society. And thank you for introducing us. And we thank all our sponsors who have helped us put on these lovely programs. I am an internist, originally trained at Howard University and did my residency here in Pittsburgh. I am originally from Pittsburgh and did internal medicine for 28 years. And then now I'm a medical director for Gateway Health. And diabetes, chronic illness, which COVID definitely affects chronic illness. We realize that is one of the reasons African Americans been having such complexity and death and morbidity and mortality of that disease because of the chronic illnesses that we.
Yes, my name is Dr. William Simmons. I am an associate professor at the University of Pittsburgh in the Department of Anesthesiology and Perioperative Medicine. I am my day, and I'm also I'm at the medical school. I am the coordinator for medical school education for third-year medical students that come to Shadyside Hospital, where I'm primarily located at. I too am a past president of Gateway Medical Society, and my role there is more of special programs. Dr. Jan Madison and I am involved in the Journey to Medicine academic mentorship program, where for the past 12 years we have been augmenting the education of inner city Black males to so that they can not just graduate from high school, but actually go on to college and actually be able to eventually be considered into going to medical school. We started this, and actually Dr. Edwards, who is on with me here, is the one that came up with the idea, because we were trying to get other Black doctors to come to Pittsburgh, and that was we don't have the draw of an Atlanta or a lot of big cities. So she came up with the idea that we need to grow our own, and that's what we have been doing. From 6th grade to 12th grade, we augment what they learn: science, technology, engineering, and math, and make sure that they and try to get them involved in the sciences.
Perfect. Thank you so much for that. And that's amazing. Like we said, we always talk about investing in our communities, investing in our children. And that's something that the both of you are doing. But to get into it, we are coming up, on holiday season. A lot of people are very excited, get, the first really big break, go home, travel, hang out with friends. But we also know that it's unfortunately flu season. So can you just talk a little bit about what the signs are for flu, what the signs are for COVID-19, and why people need to be really, really cautious as they enter into this travel season next week. Dr. Simmons and Dr. Edwards.
Well, flu is something we've dealt with for years. This is not new. But the problem is that the symptoms for flu and COVID are very similar. Most of the times you start out with body aches, fatigue, um, extreme fatigue, usually headaches, cough, sore throat, um, and that's usually the flu. The biggest difference between flu and COVID is that occasionally COVID will have a loss of sense, of smell, and taste. And that is not something you see with the flu. So if someone has lost their taste and their smell, we know it's probably COVID. But the really only way to identify the two or separate them is to actually get tested. You really cannot tell which one someone has until they have had a test for both. So during this season, probably if someone went into the hospital or into their doctor's office or urgent care, they would get tested for both if they had symptoms that was of a viral type illness.
Perfect. And thank you so much for that. And Dr. Simmons, a lot of people have questions. Is it okay to take the flu shot and, your vaccine shot and your booster shot at the same time?
Yes, there's no major contraindication to taking your flu shot and the booster shot at the same time. Actually, the only one that there is a contraindication for is that if you were an age where you're taking a shingles shot, that has to be taken alone. Your symptoms from that can be a little bit more dramatic than what you would see normally from just the flu or the COVID shot. But if you so to answer that question, I actually had the flu and COVID shot at a similar time. Mhm.
Perfect. Thank you so much for that. And we've been looking at COVID numbers. They've been going up, they've been going down. And a lot of people, still are expressing some vaccine hesitancy. In your practices, what are you hearing around COVID-19? What are you hearing? What are you experiencing around vaccine hesitancy? And what are some of the things you want to make sure the community knows a little bit over a year into this pandemic?
Well, again, as we was talking about chronic diseases, and we have to understand that African Americans have a lot of chronic diseases, not only diabetes, but hypertension, COPD. We have more history of heart attacks, strokes, and we understand that having those comorbidities will increase your likelihood of not being able to recover from COVID. People have to realize people died from the flu, which is why we have the flu vaccine. People died from that. So just imagining getting the flu and COVID at the same time and then having some other chronic disease, you have definitely decreased your likelihood of being able to pull through. I don't know about you, but this is supposed to be a happy time of the year. This is supposed to be a time of celebration, of joy. And the last thing you want to do is to leave a event and end up sick and not making it to Christmas or New Year's. So you hope that we can get over our fears, lack of knowledge, distrust, and understand that we need to do something to stop this pandemic. And we may not ever get rid of the pandemic, but I think we can control it just as we do with any other virus. And we need to continue distancing, washing our hands, wearing masks if we're in crowds that are not protected. And then if you're among those that are protected, you still need to be careful. I just say good hygiene, no matter what. We all should wash our hands. I don't understand coming out of a bathroom and not washing your hands.
I wanted to add in a little bit about the problem with comorbidities and COVID-19. There is a significant amount of studies that have been done that shows that, say, if you have asthma, it's a risk multiplier for the morbidity and mortality. It goes up 1.5 times. It's worse 1.5 times. Hypertension is, if you have hypertension with COVID, your risk increases 3 times. obesity 3 times, diabetes 3 times, chronic kidney disease. When you have COVID, your risk goes up 4 times. Now, the problem now, if you have 2 of these, hypertension and obesity, diabetes and something, then it's almost 4 to 5 times. So the more comorbidities that you have, the worse outcome that you can have from something like COVID-19.
And thank you for those stats. And sticking with you, Dr. Simmons, you mentioned if you have diabetes, you're about 3 times more likely to have a final destination type situation. Can you just talk a little bit about what is diabetes? What are some of the signs? People have been home for a year. People have been experiencing different health situations, maybe have been ordering out a lot more food, not being as mobile, not going to the gym as much. And a lot of people's health journeys have, changed and altered to their traditional trajectories over this past year. So if people need to get tested for diabetes, what are they looking for? What are some of the symptoms? And what are the types of diabetes that are out there?
The main type of diabetes that we are concerned with is the type 2 diabetes. Almost 90 to 95% of the diabetes that especially Black and brown people are experiencing are the type 2 diabetes, which used to be called adult onset diabetes. However, now we see quite a few young people and that have this type of diabetes. Now, if you think about when diabetes starts, it is such a gradual thing that people think of it sometimes as a benign disease. I mean, because it may take weeks, it takes years for it to start showing some of the classic symptoms, which are that constant hunger, that fatigue, dry mouth, blurred vision, or frequent urination. When these things start, and especially if you happen to be older or you overweight or physically inactive, or especially on a fast food or high processed food diet, these things can add up, and the devastating effects of diabetes can start to affect your kidneys, your eyes, your heart, your nervous system, your feet, dentition, and all of these things. When all of these things start to show up, you're years down the road. So when diabetes start, and most people don't really think of it as a bad problem until it starts to show you those consequences that come further down the road.
To what he is saying, generally, when you start to get symptoms of what he was speaking about, the polyuria, polydipsia, you're excessively thirsty, excessively urinating, the blurred vision, excessive hunger. Many times people have already had diabetes for 5 to 10 years and just not aware of it. So by that time, they have already had a lot of damage to their other organs. Diabetes is really considered a cardiovascular disease, which means that it causes a lot of damage to the blood vessels, causes a lot of strokes, causes a lot of heart attacks. As he said, it causes kidney failure, and so that's how come you see those happening in people, because they caught their diabetes too late. If you catch your diabetes at a very early stage and get it under control, you can usually avoid these things. And that's the sad part, when people do not catch it early enough so that they can avoid all the complications of the disease.
And an additional thing, once people go in to see their doctors and somebody says, "Oh, you have pre-diabetes." And, when you hear something like that, you just think that it's just a warning shot over the bow and that you've just you're not really any sick. The problem is that pre-diabetes puts you on a trajectory that if you don't change your diet or change your weight or do something to try to intervene, it can shorten your lifespan. It can progressive renal disease, eventually cause you to have dialysis, vascular disease, blindness, heart disease. And and even because of the vascular problems, amputations of lower extremities. All of these can happen. So pre-diabetes shouldn't be looked on as just a benign process. It's telling you that you are on a trajectory that you need to do something about, because by the time you start having other symptoms, you again might be way too late.
Thank you for that. And so, can you just talk a little bit about what are some of the treatment options available for people who have diabetes or at risk for diabetes? And what are some of the lifestyle changes people should be making if they're at risk for diabetes?
Well, one is diet. I think that, Dr. Simmons hit on that. And really, we have to watch our diet. Many people, they think of it as sugar, and they think about drinking a lot of sugar or a lot of pop or eating sugary kind of things. But we also have to understand that carbohydrates is a sugar. And so many times we forget that things like our potato chips and our rice and our potatoes in general, and anything that is a carbohydrate will cause your sugar to go extremely high. People who are diabetic should really be more on vegetables, some fruit, because we do have to still be careful with fruit, because fruit is a sugar still. It is still a carbohydrate. It is a healthy, carbohydrate. I remember one of my patients came in, and I couldn't figure out why we couldn't get her sugar under control. And she said to me, "Well, Dr. Edwards, I'm drinking orange juice." And I said, "Well, how much are you drinking?" She says, "I'm drinking a gallon a day." And I said, "Oh my goodness, no, you can't do that, because that's all carbohydrates, So she was really over her sugar load. So it's really trying to do more proteins, more vegetables, trying to stay away from the carbs and get yourself more of a balance. And then exercise. Those are the two things we can really do to help ourselves with, before you even get to talking about medication. It's just diet and exercise, especially if it's early in the disease. Now, sometimes if the disease is too far along, that doesn't happen. And there's many oral medications. I don't know if we want to get into all of them that you can try. Type 2 diabetes usually can be treated with oral medications unless you can't get it under control. And then you can treat it with insulin. Whereas type 1 that he mentioned, which we usually see in young children, and their pancreas just does not work. You have an organ called a pancreas, which makes insulin, and it doesn't work. So therefore, they have to receive insulin. But a type 2 is actually resistant to that insulin. It doesn't absorb into their cells. And because of that, that's why they have a hard time getting that glucose to drive into the cell where it belongs. So they can sometimes do that with oral medications if they're diligent about watching their diet. But if not, then they may have to take insulin also.
One of the things that the diabetics or someone who's trying to lose some weight need to consider is that a lot of the drinks that we consume, the pops, the sodas of any sort, have something called high fructose corn syrup in it, and that high fructose corn syrup is in huge quantities, especially if you're talking about a soda. You can have as many as 15 teaspoons of this high fructose corn syrup in it. Adults will get almost amount of 150 pounds of this stuff a year, and now kids are getting a huge amount of this per year, and this will truly pull the weight on. The thing about your body, when you get an accumulation of something that it doesn't know what to do with it, it turns it into fat. So the more you drink those kinds of things, the more it will just accumulate, and especially it accumulates in a way that affects your heart. It affects your body and accumulates around your abdomen and buttocks and lower part of your body to a certain degree.
Yeah, thank
I
you.
always think it's amazing. You see people, and so he was talking about, sodas, pops, depending on our area where we come from. And you'll see them get a diet soda. but then they'll have the chips and they'll have the pizza, they'll have all these carbs around them, but they're going to drink a diet soda because that's supposed to make a difference, and I'm not telling them don't drink that diet soda because maybe it does help. We don't want them to go get the regular soda also or pop. But on the other hand, again, got to think about that carb load that you're doing to yourself. You just taking in all those carbs is good food, tastes good, but very unhealthy for us.
Yeah, and just kind of looking at the chat, one of the questions is we talked about the medications for treating diabetes, particularly diabetes 2. For the people who are suffering or are at risk for pre-diabetes, is there a medication that takes with that? And what is the benefits of taking any type of medication when you're treating pre-diabetes?
Well, if that's okay, I'll go first this time.
Okay.
There is, as Dr. Edwards said, that you start off with an oral tablet. Metformin is the one that that most people are familiar with, and then you try that for a while, and then normally they go on to insulin. However, recently there has been a huge accumulation of other oral medications that has come about, Trulicity, a lot of other ones, which can supplement the metformin that you take and try to adjust your blood sugar and or actually stimulate your pancreas to increase the amount of insulin in your body, even without using actual exogenous or outside insulin. So there's a lot of different ones. I'm not going to try to name them all, but as you speak with your doctor and you speak with your medical advisors, they can come up with a plan that might work for you. It doesn't. Everybody's different. So depending on your lifestyle and your amount of exercise you get or whatever, they can come up with a plan that might be able to even stop you from having to use insulin for a while with using of some of the oral products that are available now.
But to address really the pre-diabetes, because he started out with the metformin. The thing about metformin and also something called Victoza and that group of medicines, Ozempic, they cause weight loss. And so many of them are used in pre-diabetics because they help them to lose weight. Now, some insurance will cover it for that reason, some won't. But many times the doctors will try to put them on one of the drugs that will cause the weight loss to try to help get the pre-diabetes under control, because we do realize that it's such attached to weight.
Yeah, and so for some people who are in that category, who worry about being at risk, but are uncomfortable with going to the doctor because they don't want the conversation to be centered on their weight, how should they go about doing the assessment for diabetes or pre-diabetes? What questions should they ask their doctor, and what symptoms do they really need to be paying attention to for that high risk category?
Well, I think Dr. Simmons started out before talking about all the symptoms, and the problem was with pre-diabetes, you're not going to have any symptoms. You're not going to feel anything. You're not going to feel any difference. And that's why he said they just think sometimes maybe it's a pre-warning or, because you're going to feel fine. You're going to feel like nothing is wrong. So you're going to just think someone told you had something and you're going to ignore it. What we're trying to convince you of tonight is that even though they have called it pre-diabetes, you are already starting damage to your vessels, damage that you can't feel, damage that you won't know about. So it's not a conversation you can avoid with your doctors. If you know you have family history of diabetes, if you know you've put on some weight, and then you don't always have to put on weight. Some people can be thin and still be a diabetic. It is just something that your doctor should be checking you for. That's why you should have yearly physicals, and they should be checking your glucose level to see what's going on. Nobody's perfect, not even the doctors. I'm not thin. I'm gonna be honest. I got a little weight issue myself. So I have no right to criticize. I can help guide someone about their weight, just like I would hope my doctor guides me. But I should not be critical of them or use derogatory terms about their weight. And if that's the kind of doctor you have, I'm gonna just be honest. Don't avoid the doctor. Find another doctor. That's what you need to do, because your doctor probably got some issue too that they're not talking about. But I don't think you should avoid the doctor because you don't want to talk about your weight. I know we all want to say, well, I'm going to lose the weight first, and then I'm going to go to the doctor. I also deal a lot in ministry, and I say, that's just like saying, I'm going to clean up all my sins before I go to Jesus to get saved. So that's about that same analogy.
Dr. Simmons, you seem like you had something you wanted to jump in and say.
Well, I was just thinking about what Dr. Edwards was saying, and trying to figure out that when people go to doctors, first of all, many times, especially these days when all of the physicians have to put everything in the computer, they're spending more times looking down at their computer than they are looking over at the patient. And so some people get intimidated by this, and that causes them not to ask the questions. What I'm saying to you is that you should go with your questions written down, and that you should make sure that you get everything that you want answered, so that you can walk away with some useful information that can help you with aspects of your life. And because a lot of people, when they don't do this and they get caught up in what's going on in the office, and the doctor is looking at the computer and trying to answer a barrage of questions that the computer is generating, and they have to fill out the form, people lose track of what they actually went to the doctor for. So I'm trying to say you need to write your questions down ahead of time. Let your family members help you remember the things that you need to have them address, and then even write the answers down that you get, so that you can better start the process of doing whatever change is necessary in your own life.
Yeah, I always say, like, when me and my siblings go to the doctor, we always like FaceTime just in case one person forgot to answer the question. But I liked how you were talking about, looking at your glucose level during your panels. So if somebody's going, for their annual visit or for a physical, besides the glucose level, is there any other test that needs to be run to check for diabetes or pre-diabetes?
Well, the one test that is very useful is called a hemoglobin A1c. That particular test gives you a kind of an average over several months of what's going on in that person, and it tells you that the person either was having a good diet and staying away from sweets, or it can tell you that this person has been way out of control. And it gives you, because one time getting a blood sugar, if you get a fasting blood sugar one day, that one shot one time is not going to necessarily give you a true indication or a true picture of how your health is. But the hemoglobin A1c can better gauge where you might be, and what kind of changes you need to do to get back in good situation.
As I said, I work for Gateway Health, and we just put out a campaign because people do get very hung up on their glucose level and trying to get their glucose level. So we are trying to teach people their A, B, C, D. If you're a diabetic, we say A is, like he just mentioned, your hemoglobin A1c. So the A for hemoglobin A1c. B, you should know your blood pressure. It is almost more important to get that blood pressure under control. I'm not going to say than the diabetes, but no, the literature says you need to get that blood pressure under control. You need to have it around 120/80. The C stands for cholesterol. And so again, that's a whole different thing in your diet, but you need to know your cholesterol numbers. You need to know your HDL, which is your good cholesterol. You need to know your bad cholesterol, and you need to be getting those under control. And then D, if you're truly a diabetic, you need to be getting a retinal exam. So that's for dilation of the eyes. The D is for dilation. And that's the way to try to remember as a diabetic, the things that you should be walking away with the doctor's office knowing those numbers. You should know your blood pressure number, your cholesterol number, your hemoglobin A1c, and you should have gotten a referral for at least once a year to get your eyes dilated.
And one thing that a lot of people forget is that when you have diabetes, that you can get some foot trauma, and because you all of a sudden with the vascular and the neuro diseases, you can get some decreased sensation in there and cause damage to it, and you start getting you can get some non-healing ulcers can occur on your on your foot, and those are the things that those non-healing ulcers, those are the things that can lead to amputations, and so that's why you need to have a podiatrist also in the mix. So you need to have someone that's going to be helping you take care of your feet, especially if you're a diabetic or especially an elderly diabetic, because they are the ones that tends to run into problems with their feet, and either the way the shoes that they wear, or just bumping their feet and not noticing that they have some kind of an injury that's not healing properly. So that so in addition to the things that Dr. Edwards was talking about, put a podiatrist on your medical team.
And again, you can always go to Gateway Medical Society for all your medical needs. You have questions, do screenings and assessments. So if there's something that you forgot, you can always go back to our channels and replay some of the tests that Dr. Edwards said, so you can learn like your ABCs. But when we're talking about diabetes, we're going to talk about COVID-19. What about diabetes makes people vulnerable to the COVID-19, that you're seeing in some of the literature and some of your cases, so that people understand why it's so important that they're taking these tests and taking control and ownership over their physical health?
Oh, okay. Dr. Simmons?
Okay. One, the risk factors for COVID-19, that a person with advanced age, or comorbidities, or especially minorities, and I'm talking not just African Americans, I'm talking American Indians, I'm talking even Asians, and patients from the Polynesian Islands and so forth. And so all of those are susceptible. And then social economic status. When we see problems with the social determinants of health, people that don't have good housing, people that don't have access to health care, access to healthy foods, and transportation, and live in areas that might have mold exposure. All of those things are social determinants of health, and they can worsen your outcome in every kind of medical problems that you have. And if you are in a situation where the housing is such that everybody's packed in together and you don't have good food to eat and so forth, that decreases your chances of doing well with any kind of disease that you might have. So yes, we need to know that pre-existing disease tend to worsen the course of COVID, especially in the elderly, the obese, the hypertensive, the diabetic, the asthmatic, the person with COPD, or just the stresses of life, and then it's sometimes called the systemic racism. Those things do worsen your course with COVID.
And to add to that, especially for diabetes, as I said, it's a vascular disease and it's caused by inflammation. So we already know that there's inflammation going on in the vessels, and COVID is also inflammation. So it is also causing inflammation. So if you already have damage to these areas, and now I've put something on top of it, that's going to make your damage worse. So you're already got the 8-ball already, rolling, and now I throw something else at your picture. Whereas if you're totally healthy and then you get this illness, hopefully you don't have as much damage. But when you're already damaged, it's easier to get worse. So that's why things like diabetes and all the other comorbidities make the course of the COVID much worse because again, see things that people can't see. They can't tell that their blood vessels are inside or all damaged and they look cruddy. But if they could cut inside some of their blood vessels, they would see that they're already clogged and they're already headed to a heart attack and things like that. And so then COVID comes along and they can't recover.
Thank you for that. And you're talking about, the impact of COVID-19, but can you talk about a little bit more, just about what are some of these long haul symptoms and what are some of the after effects of COVID-19? Because in addition to, some people not being able to recover, there are people who've been reporting all different kinds of long-term impacts. And, we talked a little bit, before the show about Dr. Edwards. Can you talk a little bit more about some of these like long-term COVID-19 effects? I believe you call them long haulers now.
Yeah, they have different names. Some people are calling it long hauler. That's probably the most common name out there. But what is happening, and it seems to be happening more with young people than it does with the old. They seem not to have a bad course of the COVID sometimes. But then maybe a couple of months later or weeks later, they start to come back with symptoms. They may never recover their smell and taste, and that can get even worse. I think you and I was talking. Some people say they always have a horrible smell that they're always smelling, or when they try to eat something, it tastes very horrible. The other system that seems to be, which maybe still be the same system, is the neurological system. Many people are seeming to have a lot of neurological problems. They have something called foggy brain, which we are used to hearing about when like people is on chemo and they'll talk about how they have the foggy brain and they can't remember but it seems that with COVID, people are also having a lot of foggy brain. Some people have neurologically been to the point where they've had strokes. They've had not lost the ability to ambulate and walk. So it can just about affect just about any other symptoms. I think is Dr. Simmons is at UPMC. I think they are one of the centers that are trying to study this long haul thing, because we really don't know exactly what this course is going to be like. This disease is still young enough that we're not sure how long this is going to last. Is it going to resolve? They're not sure of it. But that's why you wonder. Some people say, well, their course wasn't bad with COVID, but they never know what's the residual is going to be. So that's why you still have a reason why you want to go get the vaccine, because you really don't want COVID. I don't care whether it's a mild course or a horrible course. You don't want COVID because you just don't know what's going to happen at this particular point.
And also, what a lot of people don't realize, and they think about COVID, they think about lung disease. They think they hear about people having a hard time breathing, so they think that the course of COVID is primarily lung, but actually COVID affects every organ system in the body. There are people that after having COVID who had a perfectly fine heart now are cardiac cripples with low cardiac outputs and just short of breath and can't really make it up the stairs post-operatively. There you can have people who didn't have diabetes, all of a sudden now their pancreas has been damaged by the COVID, and now they're diabetic on insulin. And so there are many different systems, and Dr. Edwards talked about the brain and so forth. So it is not just a pulmonary disease. And as we see various variants of COVID, from the primary COVID and now the Delta, and there's others that are coming down, they may all have different focuses as far as different presentations. And so they may not just be a pulmonary specific disease. It could affect some other aspects and make you have significant cardiac problems, as I mentioned.
So we're talking a lot about the symptoms, the effects, and we know next week is gearing up to be a big travel week. Some reports estimating that this travel is going to hit pre-pandemic levels. Telling people it's going to be whether you're flying, whether you're driving, people are coming together. So, what are some of the things that people should be doing to take precautions in this next week or two, so that a lot of these symptoms they won't be experiencing personally? Dr. Edwards and Dr.
Well,
Simmons.
I hope they got their shot. I'm gonna start right there. I hope they've got their vaccine. It's kind of late to, I won't say no, it's never too late to get it, but it takes at least 2 weeks after you've had both vaccines to be fully vaccinated. And then, like for those who were vaccinated early, they're now recommending boosters, especially for those over the age of 65 or those between the ages of 18 and 64 who have some other um, compromising illness, they need to be making sure they've got their booster. So that is probably the best thing you can do for yourself. If you're planning on traveling, if you're planning on, being with a large crowd, with family, hopefully you have gotten your vaccine. If you have not, as I started off, then you really need to seriously think about social distancing still. You need to still think about wearing your mask. I know your family might look at you like you're crazy, but you're not only protecting you, you're protecting them because you don't know whether you have it and you could be spreading it to them. You need to be washing and watching your hygiene. Um, so those are the things that we know that work. If you're in a closed facility, you want to try to get as much air moving. I know it's going to be cold, but you might want to open some windows if it's a real closed, or try to figure out how to have a nice festive activity outside where the air is moving and circulating. Um, and then truly, if you think you're someone who is compromised, I'm gonna just be honest, you might not should go. You should probably avoid that whole situation.
Recently, we've been seeing people accumulate at, say, football games. Penn State had about 100 and some thousand people in their stadium, very few of them wearing masks and so forth. So people are kind of acting like COVID has gone away. I'm sorry to tell you that it has not gone away. It may be cycling, and you might, if you still look at the numbers of cases in Allegheny County, you will see that they're on the rise again. And so don't be persuaded to think that, oh, they can just act normal and just go ahead and do things that you're used to doing. Granted, we have been isolated for the last couple of years, and we didn't have a good Thanksgiving last year, and so people are just anxious to go out and see family. But you should keep your social distance, wear your mask, and be cautious when you get into crowded situations, because that you can easily become victim to viruses that are being spread, and that is one of the things should be the takeaway point. Be careful. This is not over.
And part of being careful, you mentioned earlier, Dr. Edwards is taking the booster shot. Can you just talk a little bit about what advice is there out there? Because some people got Moderna, but when they go to sign up, there's only the Pfizer booster shot. Some people got the Johnson and Johnson, but they're not. They don't feel as comfortable getting a Johnson and Johnson booster. Is it okay to mix, your shots? Is it, is that okay? And what should people be looking at when they go and get their booster shot?
So presently, they say it's okay to mix the shots. Probably really telling people who've gotten Johnson and Johnson to definitely try to get either Moderna or Pfizer, because the vector is different, and so they would be getting the mRNA, which they did not have if they got the Johnson and Johnson. But they are sort of telling you that if you find what you find is what you should get. Still, that's the theory right now. When Moderna and Pfizer first came out, they told people don't be fighting over and waiting for one or the other, and it's still the information for the booster. I think both of them are readily available. So I know I just got my booster Tuesday, and the place where I went and got it, they were giving all three. So they had them all there. Um, but you should be comfortable that if you only can find one, that's the one you should take.
Now, we haven't, even as a country in the United States, our numbers are still not at the level of herd immunity. We still have only about 50 or possibly closer to 60% of the population that has actually gone and gotten the vaccines. We truly need a much higher accumulation of people to take the vaccines so that we can have more protection for our population. You have seen the devastation, especially to African Americans, that COVID has done, especially with all of the coexisting diseases that we have. We tend to have a higher, a worse course and a higher death rate per 100,000 people in all of these communities. And so if you look at communities that are primarily that are high concentration of African Americans, especially in Georgia and Virginia and so forth, where they exist, you will find that those places have a huge, they are among the highest as far as the counties involved of having death rate associated with COVID. And so even though we don't get reports from every state, we can definitely recognize that African Americans are adversely affected and should take special precautions, especially if you have coexisting diseases, because if you catch it, it can definitely harm you significantly.
Miracle, I just want to add something. We was talking, and I quoted my own self wrong. So if you're on your third shot, that's where I'll start this conversation. There is actually two ways to get the third shot. One is considered a booster, and then the other one is considered a third shot. With the third shot, it is that you're actually getting the same dose that you got with the first and second shot. If you get what they call a booster, it is actually a smaller amount with the booster. The reason some people should get the third shot as opposed to a booster is because they do have these autoimmune immunocompromised. Where did I go?
We can still hear
I'm
you.
sorry. Okay, I'm sorry.
It's fine.
All these devices. So you have these. Your immune system may not have responded to the first two shots. That is the concern. What is this going on? The first two shots, and so for that, they think you need a full dose of the third shot, and that's why they're telling you to get a third shot. For other people, they just think that maybe the level is waning down. And so that's why they're telling them to get a booster, because they need to kind of pump that up. So if you know you have, if you've been on some medications, steroids, chemotherapy, there is also some other autoimmune kind of medications, and you know you have some of those diseases, then you need to talk to your doctor and ask them which one you should be getting.
Perfect. And thank you so much for that. So for clarification, you can get a booster or you can get a third shot. I do remember I believe it's Moderna, their booster is like just like half of their second shot. But you're saying if you are immunocompromised, kind of in the high risk category, it's better to get, that full third dose. And so when you go to the vaccine clinic, and I think Dr. Williams in the chat was saying there's 2 vaccine clinics on Saturday, one in Wilkinsburg and one at the Children's Museum, which is very important. Just recently, the health department said it's okay, and the vaccines are approved for children as young as 5. So it's
Pfizer, I believe.
Pfizer.
I don't think Moderna. Right. I don't think Moderna has that indication yet, but Pfizer does.
Just Pfizer for children as young as 5. So I think it's very important. And to, just kind of, as we're winding down, to kind of recap for especially people who are just joining us, we talked about, like people's health at this time. It's getting colder, the flu is here. telling people, there's a difference between the flu and COVID-19. You may not know it until you go to the doctor or the hospital to get diagnosed. It is safe to get your flu vaccine along with your COVID-19 vaccine, but you should not get it with a shingles vaccine. A shingles vaccine should be taken, separately. But with like the flu and everything's happening right now, should people still be wearing masks? Should people when they go out, and even into the future, because this is flu season, and flu season is going to go for a couple more months. Or what other precautions should people be taking to avoid the flu?
Something we know from last year, because we all were isolated, or not isolated, but we were staying in more, we were wearing our masks, we didn't even have the vaccine. But the level of flu last year was almost nil. We just didn't see it. It wasn't in the emergency rooms. They were seeing COVID, but they were not seeing the flu. That does show that these things that we're asking you to do, wear your mask, distance, and hygiene, does work, because it prevented the flu. So we know that if you would do these things, you can protect yourself even without the vaccine. But I still advocate for the vaccine if you can get it. And then and still do those things. Yes, you should still wear your mask. I know I still put mine on. Especially if I don't know who I'm going into, or I'm getting into a situation, walking into the grocery store, Lowe's, I put my mask on. Yeah, I still wear it. And I don't care if people look at me, I'm gonna put my mask on. Those people don't have to take care of me if I get sick. So
Facts. And Dr. Simmons, this may seem redundant, but you talked about, thousands of people being in the stadiums and at football games and concerts. If I have the COVID-19 vaccine, does the COVID-19 vaccine prevent me from getting the flu or any of these other viruses that are out there? As I say, what, I'm not going to wear a mask because I'm vaccinated with COVID. Just for the people out there, because sometimes people, they conflate things.
No, it does not. The thing is, if you look at the studies that were done on COVID-19, they say 95. The first when they first came out, they're talking about 95% decrease in your severity of disease. They didn't say that it killed the disease. It didn't say that you couldn't get it. It just said that you won't be nearly as sick if you got the shot than if you had if you didn't get the shot. So the thing is, even people are surprised after they get the full battery of vaccinations, they still get COVID, and they say, "How come I got COVID? I mean, I got my shot." It does not stop you from getting COVID. It decreases the severity of disease that you will have when you get it, and it doesn't stop you from spreading it to somebody else. So even if you had your battery of shots, wearing a mask is still protective of the people that are around you, because if you got it, you might be a carrier. You might give it to someone who did not get the vaccinations, and they might have a significant problem. So there's some subtleties in the way that this was presented, but I'm just trying to tell you that you are not protected from getting the COVID. You are protected from getting a very severe case of the COVID.
And then for people with comorbidities, this is really giving you a fighting chance.
Absolutely.
Just because the comorbidities really increase your risk of having a very severe reaction to COVID-19 and often fatal.
Absolutely.
agree. Yes, very much. You said
All
it
right.
right.
I think, I'm feeling it. So I think, I'm getting
You
it
don't need us
together.
anymore. You got it.
I got it. And so it is very cold outside. People may be going out more, maybe inviting people into their homes more. Do we fear a risk of increased hospitalizations the colder that it gets? Or are we hoping that the colder it gets, people just don't go outside as much?
You hope they don't go out as much, and you hope that we don't gather in the homes as much. You have to realize this year, a lot of places last year, offices were closed. People were working from home. Many people have returned back to work. So you're now going to have all these people closed back up into buildings. So it's definitely going to be a different year. Um, I advise people, if someone's walking into your house, you need to ask them if they had the vaccine. They're walking in your territory at that particular time. If they don't want to come in or they get insulted and say, leave. But I think you need to protect yourself. So I think you need to ask them if they haven't had the vaccine. I would ask them to mask, and I would wear my mask at that particular point. I mean, I know it's sitting in my own house. I don't like to wear a mask, but if somebody comes in here that I really need and they have not had that vaccine, I require us both to mask at that particular point. Because as Dr. Simmons says, even though I've had the vaccines and had my third shot, I realize that I can still contact the virus. I believe my chances of getting sick is less than someone who hasn't had the vaccine at all, but I realize I can still contact, and it's still, because it's a nasal, it still can get up into the nasal part. The vaccine helps the part that's down in the lungs, but this is something you bring in through your nose, and so you can still bring in your nose, and the vaccine doesn't really protect this part, protects this part, the lungs. I don't know if you all can see my chest, but protects the lungs. So yes, you need to ask people to mask. That's just the key here.
In regards to hospitalization, the Cook County in Chicago did something that I thought was completely fascinating. They looked at the effect of COVID on their emergency room and emergent conditions. And they looked at March to May of 2019 and March to May of 2020. And what they found was that during the time that COVID was, because all the people who were sick was going to the emergency room, many other people, regardless of the kind of condition that they had, would not go to the emergency room. So they had a drop in that period over those 2 years of acute MIs. It was dropped by 48%. The heart failure they saw in the emergency room was down by 50%. Strokes were down by 53%. And appendicitis was down by 80%, and so forth. So and then they're saying, does COVID cause those diseases to go away? No. What they also were able to find was that the degree of people having found dead at home or death at home went up tremendously. So people, instead of coming to the emergency room or going out, actually ended up dying at home because they were too afraid to go. So I'm hoping that that fear has gone away, so that people indeed, when they need to, can go to the emergency room and get care, whether it be for colds, flus, or something more serious. But there was a time, especially during the height of COVID-19, that people didn't go. And we had a problem as far as with in the inner city and Black communities, because all of the doctors decided that they were going to go on Zoom, and they would go and they want to a lot of people in the inner city, one, did not have the connectivity to go on Zoom to see a doctor. And those who did have it may not have been comfortable with trying to explain their medical problems on this kind of platform. And so they just plain didn't see it. So diabetes got out of control, heart disease got out of control, and a high blood pressure got out of control because people went for more than a year without seeing a doctor because they had no access to do so. So we've learned quite a few things from this, but I'm sure that this is not the only time we're going to have a pandemic or some kind of catastrophic event. So we have to learn that, in Pittsburgh here, we are a tale of two cities. There is the very educated and people that have access to the medical community. And then there is the other people who have limited access, limited food, limited housing, and we are seeing that they are most severely affected because of those limitations.
Thank you for that. And I think that it's very important that people need to know why organizations like Gateway Medical Society exist, because you're seeing, culturally competent doctors, doctors from your neighborhood, doctors who understand, what's going on in your communities, and are able to give you really good individualized health plans and supports to do these, these vaccine clinics, these flu clinics, other type of health screens you were doing even before the pandemic, coming out, with the mobile clinics up in, to different neighborhoods. And I think it's very important. But as we wrap up, is there any last words of wisdom and advice you'd like to leave us with? Anything about the flu vaccine we need to know in these final moments with this program?
The final thing that I might say would be that people have to understand that it is the American diet that we have to be very careful with, because there are many things that we eat, the fast food and all of this, that can compromise you very much. And I understand that eating good can be more expensive. And when you're in a situation where you are on a budget and you don't have, and you have many different people to feed, you may not be able to go out and buy all of the luxuries, the fruits, the vegetables, the kind of things that you really need. But you have to figure out, and there are different organizations in the city that can help you get the kinds of foods that you need, so that you can have a healthier life.
I just want to say to everyone, get knowledge. Make your decisions because of the knowledge that you have gained. Don't make decisions on ignorance or fear, but make it because of knowledge.
Absolutely.
Thank you. Yes, and that's one of the things we try to do on it. Inform you so you can make, the best decision for like you, and your communities, and your family and your friends. There's a great, that we have, the Pittsburgh Food Bank. They are a great resource for foods. There is 412 Food Rescue. There is CM and other organizations. So if you're someone who is having questions about how to eat healthy, you can always reach out to those organizations. And I'll do the last plug for Gateway Medical Society, because they do have, professionals to help you navigate your diet, as well. We like Dr. Edwards and I said, we're both people, of a certain size, and we're trying to do our best. And, we're, out here, some days and I may have a piece of cake. Some days I may just have a green smoothie, things happen, but it's all about moderation. We're not fat shaming anyone. We want people to make the best, decisions for themselves and their families, to understand that, a lot of this stuff is not only access, but education. So we're all learning together, and with love, we're all changing and growing healthy together. And with that, I'm going to sign off for Ask a Black Doctor for this Thursday. Thank you so much to Dr. Simmons and Dr. Edwards of the Gateway Medical Society for joining us. I'm your host, Miracle Jones. I hope you all have a great evening. Thank you all so much for tuning in.
Thank you very much.